Okay, so for those listening, I want to really be able to separate anyone who's been injured in a motor vehicle accident. This is for people who have soft tissue injuries that are not fractures or open wounds that need immediate emergency attention. So those things I'm going to separate those out, because many of the motor vehicle accidents that I've seen over the past 20 years, there are not fractures, there are no lacerations, and many of my patients feel like they have been tackled by a 300-pound linebacker after they get into a car accident, and they don't know what to do about it. They've experienced headaches, back pain, numbness and tingling, fatigue, brain fog, a whole host of scenarios. So the physics are just not in our favor. Most cars, a small car is 2,000 pounds, but you take SUVs and they're like 6,000 pounds. The average human is maybe 120, 130, 140 pounds. So the equation just doesn't, we don't benefit as humans getting in car accidents. And most of us have been in at least two by the time we hit our 20s. And we don't, that's only like 3-4 years of driving. So the occurrence is it's just prevalent in all of our society, especially I live in the Washington, D.C. area, and it seems that there is a lot of car accidents here, and it stinks. And, I'm teaching teenagers how to drive as well. So I teach them how to drive defensively. So back to the point, the most important piece to dealing with what I consider a musculoskeletal or soft tissue injury after a car accident is the speed of treatment. So there's a couple things that you have to take care of. One, when you get a soft tissue injury, usually what happens, another name for a motor vehicle accident, a biomechanical term, is a cervical. Usually when you talk about whiplash in the neck, it's a cervical acceleration deceleration injury. And in second grader terms, it means that the joints of the spine move faster and further than they normally do because the muscles cannot contract fast enough to create resistance. So usually what happens in these acceleration deceleration accidents or traumas, and the same thing happens in football or in boxing and things like that, where the internal aspects, the joints of the spine, those are what get injured. Now, each joint of your spine has a nerve that connects to it. That nerve connects to and controls and coordinates the muscles that move those joints and all the joints above and below. It also contracts and attaches to the skin and everything else that's surrounding there. So you have this injury, this very deep internal injury with all the concomitant symptoms, from muscle spasm to pain to lack of range of motion. So if all you do is treat those symptoms from the outside in, you're missing out on really the causative factor of the injury. And if it's not addressed fast enough, this can become a permanent injury because you have these ligament tears or damage deep within the spine. So that takes more time to heal. Taking inflammation down is very important. Safe range of motion, usually from a passive perspective, meaning the therapist should move you versus you moving you. And then walking hand in hand with a therapist to actually get those joints to heal and move appropriately within safe ranges of motion. Another important factor is actually getting you into a healing state. Usually when you get in trauma, whether it's physical, emotional, whatever that is, your fight or flight system heightens. So all the hormones in your body are like ready to go and fight. So a lot of the approach and a smarter approach is actually to down-regulate the nervous system and put it into what's called a parasympathetic state so that your body can actually heal. Some of those things are as simple as belly breathing. You'd be like, I just got a car accident. Why the hell am I belly breathing? But it actually makes a lot of sense to take your whole nervous system down into a healing state. So making sure the lymph is drained. There are things like taping that actually can hold the posture in a more safe and healing position. I'm not a fan of immobilization, because immobilization, like I equate that to like if you're walking in the woods and you come upon a pond that is stagnant, what do you see there? All the yuck that builds up there. It's the same thing in the human body and healing. Now, there is a portion of time where the tissue that gets damaged does need to heal. However, movement is one of the best medicines that you can apply very quickly, but safe movement doesn't mean that chiropractor is going to come in and crack your neck, and we save that for the eggs. So we're going to do mobilization and adjustments that are going to help align posture and move the joints of the spine safely.